series from OnDefend, we're taking a look at some of the top cybersecurity headlines, dissecting what happened in them, and then sitting down with a security leader to get their inside take. This time, we're breaking down the Blackcat ransomware gang's attack on Optum, the operator of the Change Healthcare platform, with Baptist Health Jacksonville CISO, James Case.
I think the entire healthcare industry is impacted.
Here's what we know. Change Healthcare, a payment exchange platform that connects doctors, pharmacies, healthcare providers, and patients in the U.S., was attacked by the Blackcat ransomware gang in late February. The ransomware gang also claims they have stolen more than 6 terabytes of data, which has been confirmed by Change Healthcare to be a, quote, substantial portion of people in America's sensitive data, end quote, leaving them with no choice but to make one of the largest reported extortion payments to date of an estimated $22 million. A drop in the bucket, though, compared to the more than $1 billion the company is expected to pay out when this is all said and done. Now let's go behind the scenes with a CISO. Name and title.
Oh, James Case, CISO for Baptist Health in Jacksonville, Florida.
When those incidents happen, what goes through your head? Even though your hospital's not impacted and you can be in another state, what goes through your head?
I mean, some thoughts that come to mind are, if it's somebody local or somebody I know, how can I help, first and foremost? And if it's not, if it's somebody far away or someone I don't know, then it's, what can I learn from that? How can we learn from that? What can we do to make sure that we're not vulnerable to that or that doesn't happen to us?
Does that automatically spur a change within your security program when something like that happens?
It's a reminder, it's third-party risk, right? So it's maybe in our tabletops, maybe it's a reminder, or it feeds into our feedback loop on scenarios to really tabletop. And so really tabletopping third-party risk maybe is something that, that we should all do more and more.
What do you think is the biggest thing you guys are saying as a security group together after incidents?
It's continually assessing, continually learning, continually validating. How can we improve? At the end of the day, all those are key parts. How do we continually improve? How do we show improvement? How do we track our improvement? How do we make sure that we're improving? Can't get rid of all risk, but we can get rid of some. Well, let's find it, let's prioritize it, and let's knock it out.
Yeah, I mean, you said risk, so we obviously see all the headlines, but I mean, you can only show so many headlines to people to get them to understand. So when you talk about risk, what are you saying?
Always explaining the why, right? So when we, I hear people saying, we're trying to increase security, and I always pause and ask them to stop and take a step back. We're not increasing that, we're really trying to lower risk. So focus on lowering the risk and the why. And that's the why. So we're trying to stop this from happening. So that's the why.
Let's talk about ransomware and healthcare. I mean, they just go hand in hand at this point. What does a ransomware threat mean to the healthcare community right now?
It's the number one risk, and for most hospitals, patients and hospitals going offline. And then if one hospital goes offline, it really impacts the whole area. So people have to go somewhere, or like ambulances have to go somewhere. And so there's diversion, and then it's more impacting than people think.
It's more impacting than people think. In what way? How much are people not realizing the impact it can actually have?
One I just said, where it hits the whole community really is part of it. And then two, the hospital itself, right? Patients, their charts are gone, right? So people are going back to paper, and at this age, now that we're in 2024, the whole phrase going back to paper is getting less and less real. People practice, practice and we drill for it, but when you're really doing patient care, it's different, right?
What would you say is the number one, concern when it comes to a ransomware threat?
Yeah, I mean, number one is patient care. Number two would be the whole financial impact, right? I mean, hospitals struggle to make a 1% margin, maybe 2%, right? So we're breaking even if we're lucky. So a huge impact like that could put hospitals or us out of business, and so that's a huge concern. But the first and foremost, it's about the patient care. It's about the patient either in a room, really being treated at that moment, or the one on the way in trying to be treated, and that maybe if our systems are offline, then they're delayed or can't receive care.
Why ransomware? Why healthcare?
Well, I mean, the answer is pretty easy there. It's about the money. Healthcare is a pretty easy target, and also healthcare is kind of behind, right? Like the financial sector is years ahead from a controls perspective and a regulatory perspective, and then way more financial resources, right? Going back to hospitals, trying to break even or trying to make a 1% margin just to stay afloat. Well, then there's not money, to just add to the budget to add more controls and add more technology to stop the attackers. And so it's a tough balance.
I mean, overall, do you think that we'll ever beat out the bad guys?
There's no answer to that, right? No, I don't think. It's always going to be cat and mouse, right? Just like there's no way to eliminate all risk, there's probably no way to eliminate all bad guys. All you can do is find risk and reduce it, and hope you're not the next person.
Discover if your environment is prepared for a ransomware attack with OnDefend's Ransomware Defense Validation service powered by BlindSPOT. This all-encompassing service supports security leaders in reducing risk by simulating real-world ransomware threats to validate your email gateway, endpoint security measures, and monitoring response capabilities are working as expected. One offering, multi-level assurance with Ransomware Defense Validation.